presentations in general can sometimes be, a little bit different than, the in-person interaction. I can't wait till we can do some things in person, but I'll introduce myself. My name is Mary Werdebaugh. I'm Director of Community Outreach of Organic Remedies Medical Marijuana Dispensary. I'm also an adjunct instructor at Harrisburg Community College, where I teach one of the first accredited courses on medical cannabis. And also starting actually next Monday, I start a course at Shippensburg University as well. This is a non-accredited certificate program where I'm going to teach dispensary operations and also the endocannabinoid system of medical marijuana. So I'm very, very excited for that. Lots of education happening in Pennsylvania on the medical marijuana program in general. And I'm very lucky to be in a state that's so medicinally focused, for sure. But I've been with Organic Remedies since we opened, which was back in March of 2018 in the Chambersburg location on Wayne Avenue, where the old Sheets used to be. And now it's a very different setup. But right now with COVID and everything, we're doing everything curbside delivery, but soon we are looking to open up again. And just as anything, we're kind of taking it day to day as, restrictions change and just kind of wanting things to go back to normal, but want to do it safely and take the proper measurements as well. But our topics today is going to be the overview of the Pennsylvania Medical Marijuana Program. I'll talk about the qualifying conditions, a little bit of the science behind the stigma. I'll talk about what THC is, what CBD is, and terpenes. The available products in Pennsylvania, patient and caregiver registration. I'll talk about where to find certified physicians and the pharmacist role in dispensary relationship. So what it's like being a patient in Pennsylvania is a lot different than in other states because you do get to speak to a pharmacist. So I'll talk about that as well. And then, of course, some time for a Q&A. If for any reason you have any questions or something comes to mind, feel free to just either call me or just always shoot me an email. I'll give you my contact information at the end as well. So how did we get here? April 17th in 2016, Governor Tom Wolf signed Act 16, which is the Medical Marijuana Act. Basically, this act was created to keep a patient protected in Pennsylvania. Pennsylvania was the 24th state to legalize medical marijuana. And Act 16, again, was structured to really encourage research, which now we are working with the Philadelphia College of Osteopathic Medicine, conducting research on medical marijuana. We had, in the last 6 months, 300 patients sign up for a research study, which they're going to conduct a 1-year, 5-year, and hopefully a 10-year study as well on the medicinal plant, which will be incredible to see, what we, can conduct from that. And Pennsylvania is one of the few states to create specific roles for pharmacists and other healthcare providers. So if you're in a different state and you walk into a dispensary, often you don't see a pharmacist or you don't see a physician because they don't have them on site. In Pennsylvania, whenever you come into a dispensary, you're able to get both perspectives of medicine by talking to a pharmacist that can tell you, any medication interactions you may have, or if you're depending on what your ultimate goal of being a medical marijuana patient is, what, the best steps to take to be able to achieve that. And then also all of us here, patient care specialists, are specifically through the Department of Health trained to be able to learn these products and know what's going to be your best for you, depending what your goals are and what you're, looking to get out of being a medical patient. And so what do the regulations require? We have very, very extensive seed to sale tracking. Basically, that means anything that you purchase in a dispensary from when it is put into the ground to when it's packaged and into the patient's hands is tracked through the Department of Health. So that means that everything is lab tested and it's all does not leave the state of Pennsylvania because of it being federally illegal marijuana. It cannot leave the state. So nothing is outsourced. Like sometimes you can pick up a CBD bottle from, a random drugstore, and it can be something out of the country even too. That's where things can get pretty gray. So in Pennsylvania, everything from seed to sale is in Pennsylvania and tracked through the Department of Health to make sure everything is regulated very specifically. Like I said, we have very specialized training for physicians, pharmacists, nurse practitioners, physician assistants, depending who is in the dispensaries. Organic Remedies Often the background seems to be most of them are from CVS and Rite Aid that have came to the dispensary side, just because they have respect for both sides of medicine and have seen great benefit in patients using medical marijuana or using that in addition to their other treatment as well. We have very specific education for the owners, employees of the medical marijuana organizations, and everything is through the Department of Health approval as well. And that's a little snapshot of our York dispensary inside. So it's pretty cool. We can see a picture. It's tough because we can't really give tours or anything. I wish we could, of the dispensary and to show you what it looks like inside, but that's just one of the waiting rooms in our York dispensary, one of our newer ones. In this area, we have 3 dispensaries in York, Enola, and also Chambersburg as well. And the qualifying conditions. So to become a medical marijuana patient, basically you have to be recommended, not prescribed. And I kind of really stress that because it's not really a prescription, medical marijuana. It is just a recommendation that either the medications that you're on are not working, or the side effects are more harmful, or you just want to try something alternative. And if you have one of these 23 approved conditions, you can be recommended to have a medical marijuana card. Anything ranging from ALS, autism, anxiety is one of the most common ones that we do see, as well as cancer, Crohn's disease, anything in the disease in the nervous tissue, any spasticity disorders like epilepsy, also glaucoma, HIV and AIDS, Huntington's disease. All of these basically are ranging between either a neuropathic or inflammatory, or just severe and chronic pain. Severe and chronic pain is the most common one that we do see in Pennsylvania, just because it is such a vague diagnosis. This can be anything from, chronic back pain, chronic knee pain. If someone has been on opioid medication for, a long period of time and they're looking to get off it, they can also be qualified under the opioid use disorder. That is one of the newer ones that were added to the list. Also PTSD. We work with a lot of veterans. We work with a lot of, groups and mental health programs that we do see quite a bit of that as well. Right now in Pennsylvania, we're looking at about 509,000 patients just in PA. So that is, 500,000 of our, community in Pennsylvania that are medical marijuana patients. It's sometimes it's a bit humbling, looking at this 23 approved condition list. And these are very serious disorders. And it's very tough. A lot of them are invisible illnesses. And when you see these patients every day and working with them one-on-one and seeing them get some relief just by, trying something different, or, knowing that, this probably wasn't their first form of treatment. They could have, talked to a doctor where, their medication that they had gave them these awful side effects, or, they've been on the medication for 10 to 20 years and just not getting the relief they wanted. So this is kind of their last resort. Seeing that desperation and seeing that, we can change a life just by, listening and hearing someone out and having respect of both sides of medicine, knowing the medication that they were on, could have helped for that short period of time. But, now here, years later, we see it all the time that, they're just looking for a different, an answer, an alternative answer. So a little bit of a closer look, a therapeutic option, again, have been exhausted. We see this all the time. Even myself have experienced this. I'm a patient myself, and I was on steroid medication for some stomach issues I was having for years. And for the first about 3 months, it really helped. And then, after a year on it, I started gaining weight. I started feeling very swollen, a lot of pain, a lot of other things that I never dealt with at such a young age. I definitely wanted to just, get in a different side, or like I didn't want to, fast forward to 10 to 20 years from now and still be on that medication and not really see a way out. So trying to really change my life. And that's why I'm here today, working and talking about medical marijuana. But if the physician may specify a dosage form. So whenever you talk to a physician in one of the medical marijuana approved ones, they may specify a form. Like, for example, we do see pediatric patients as well, autism being one of them. the physician may specify, no vaping for this patient. Or if someone has any respiratory related illnesses, no vaping for that patient. Or they might say, just start off with a lotion or tablet. The pharmacist on duty, whoever is, recommending a product, will definitely put the physician's recommendation in consideration. But otherwise, us here might specify a different strain or dose. Strains can be a different type of marijuana. The word indica and sativa. These are just types of strains that will give you different effects. An indica is meant for nighttime. They kind of give the funny slang term, but an easy way to remember. Indica in the couch. It's going to make you very sleepy, very sedative, relaxed. Sativa, on the other hand, is similar to coffee. Kind of like something that would help promote focus, but without the jitters. It helps keep you a little bit energized, sharpens your focus, and makes you basically want to get a lot of things done and feel energized doing it. Mixing the two can be called a hybrid, so it can give you more of a balanced effect. So a dose for 1 milligram or multiple times a day just depends on the form that you're using if you have to redose that. So a little bit about the science behind the stigma. So why does marijuana even work? Why does it make you feel anything? Whenever you use marijuana, it activates your endocannabinoid system. Your endocannabinoid system is your bodily functioning system. Everyone has one. And whenever you go for a run, you can feel that natural runner's high. Marijuana basically just helps these CB1, which is stored in your nervous tissue, and your CB2 receptor, which is stored in your immune cells, just work better and help work more efficiently. In your CB1 receptors, it can help promote appetite stimulation, help with pain, can give you some perception changes, so some euphoria, can help with muscle relaxation, and also seizure suppression, CB2 receptors that are stored in the immune cells can help with pain suppression and also anti-inflammatory. Cannabinoids are chemicals that are in the marijuana plant. In the marijuana plant, there's over 550 chemicals naturally in it. THC and CBD are just the main two. THC is what if you buy marijuana off the street or, not from a dispensary, generally it is all THC, just because it is the most prevalent chemical in marijuana, and also it's easiest to grow, because CBD, on the other hand, can take some different breedings and different, but THC is most prevalent in the plant. This can induce an intoxicating high, having plants that are high in THC, and also it may help with pain, stress, nausea, appetite loss, and sleep disorders. THC, when it is medicinally dosed, can be incredible, especially for helping with the pain, stress, and nausea, appetite loss. When it's overused, like, just using the very generic Cheech and Chong movies, but whenever it is smoked, you're basically getting a very, very high amount of THC, which is going to give you, just like overusing anything, is going to give you very strong effects. Whenever you use THC medicinally, whenever it's medicinally dosed, like vaporized, or it's medicinally dosed with certain milligrams, it can give you very medicinal effects, like helping with your pain and stress, nausea, and appetite loss. CBD, on the other hand, is non-intoxicating. It does not induce a head effect or a high, and it can counteract some THC's intoxicating effects. So whenever you use something from a dispensary, that can be a 1-to-1 ratio or a 4-to-1, THC to CBD, they often balance each other out and really help keep those euphoric effects at bay. CBD can also help with anxiety, arthritic pain, inflammation, and sleep loss. There is natural terpenes in cannabis as well. I know there's a lot going on in this little flower, but terpenes are basically what makes it smell, and basically also what makes it taste certain ways as well. Terpenes are found in all plant material, like oranges, lavender, pine. Terpenes, like myrcene, are found naturally in thyme and mango and lemongrass. And they're also found in cannabis, and they're believed to promote calming effects. Caryophyllene is found in black pepper, cloves, and cinnamon, and they're to promote anti-inflammatory effects. Pinene is used for pain, and they're found in pine needles, rosemary, basil. Sometimes you can open up a container and smell it, and it'll smell like really peppery and really like almost spicy. And that's because it's high in the terpene caryophyllene. And so you'll know that that strain naturally can be really good for anti-inflammatory effects, which can be really interesting. So available dosage forms in Pennsylvania, we have solid dosage forms, which can be tablets and capsules. These will give a little bit of a delayed effect. Just like anything, taking a capsule will be best absorbed or most effectively absorbed if you eat something higher fat, like taking peanut butter with it, something high in oil. Takes roughly about an hour to kick in, and then will take about 6 to 8 hours. You can feel the effects for up to 6 to 8 hours. It's very important whenever working one-on-one with a patient, we definitely put into consideration their absorption rates. Just like taking a capsule, sometimes someone feels it very quick and very sudden, and sometimes someone doesn't feel it at all. So that can really have a lot to do with their absorption rates. Whenever I was having a lot of GI issues, I know myself, I could have, high amounts of, medication or something that my doctor would prescribe me, and it wouldn't help because I wasn't absorbing things most effectively at the time because I had a lot of that inflammation. But once I treated the inflammation, my absorption rates did get better. And then we have oral liquids. Tinctures are a liquid dropper that go directly under the tongue. They're often oil-based, so they're very mild. Like anything, oil does separate with water. So whenever you shake it up really, really well and then put it directly under the tongue, it would take roughly about 15 to 30 minutes to kick in and last about 3 to 4 hours. Rick Simpson oil is an oil applicator. It is the most bioavailable product that we have in the dispensary because it's the most concentrated. It is the texture of almost like a thick tar molasses type and dark, almost like molasses. This is put onto a piece of food because it doesn't taste very good, but it is so strong that you really only need about a quarter grain of rice size. This can last up to 8 to 10 hours and will take about 45 minutes to an hour to kick in. This can be really good for patients that are not able to redose throughout the day if they're in chronic pain and need something longer lasting, or need something throughout the night to help them sleep. Topicals like creams, ointments, and balms are good for localized pain. If someone has shoulder injury or knee pain, they can put that cream or ointment directly on the area that is bothering them, and it can be really helpful. We also have transdermal patches and suppositories. This isn't a very common form that we have, but we do have these available. These can be good, especially the suppositories are more newer to the Pennsylvania market, but I have heard tremendous relief from patients that have endometriosis and pain in the stomach area as well. Depending on, that can take, again, about 45 minutes to an hour, but then will last up to 6 to 8 hours. That can give the patient very long-lasting relief. And then we have vaporization. This can give a patient immediate pain relief. It can take about 1 minute to 2 minutes to feel the effects, and then last just about an hour, depending on their levels of depending on their experience with cannabis. That's whether if they need something highly concentrated, like a wax or butter. Basically, that's a fancy term for just a higher concentrated form of THC, or they can just use an oil that would be in a pen, like the picture in the middle there, and also to the left as well. You would put that on a battery and vaporize it. One thing about vaporization oils, I know there is a big vape crisis across the country. All of the vaporization oils do not have filler oils in them at all. They are just pressed cannabis, either in a CO2 form, meaning the cannabis is extracted using CO2, or a liquid live resin, which means the cannabis is flash frozen, then extracted into the oil. There's no vitamin E oils or nothing added that's not pharmaceutical grade. Or safe for human consumption. If someone does have, respiratory related issues, though, we would try and steer away from vaping just until those are resolved, or just use another form that may work better for them. Dry leaf and flower is the raw flower plant that you would just generally see, that you would, purchase anywhere really, off the street, but in a dispensary, of course, it is just grown in Pennsylvania from seed to sale and regulated as well. This is meant to just be vaporized. So no glass, no smoking is approved in PA and is actually illegal in Pennsylvania. The Department of Health sees vaporization as a more medicinal dose. So basically, when you take a vaporization hit of flower through a vaporization pen that we do offer, you're getting about 2.5 milligrams of THC per hit. So you're getting a very medicinal dose by vaporizing that. So potential effects short term, and all of this can be very regulated depending on the amount you're using. So it might give you a little bit of a cough, euphoria, dry mouth, dry eyes. These are really the only negative reactions that you may see immediately. Possible sedation or anxiety just depends on the amount that you're using, the form, and the strain as well. So talking to a patient care specialist can really help control these for sure. When I say sedation and possible anxiety, just like drinking too much coffee, this type of strain I said earlier, sativa, is just like that. If you have too much coffee, you can feel a little shaky or just kind of not yourself. If you are, susceptible to anxiety, sativas can bring that up a little bit. So you might need something a little bit more relaxing. And like I said, talking to a pharmacist or one of our patient care specialists can really control these effects. Longer term is if it's ingested or eaten. If you had too much, it can cause a little uneasiness, sleeplessness, and also euphoria, short-term memory loss. This is definitely depends on the amount that you're using. So starting low and going slow, that is definitely our motto. You can always add more, but whenever you consume cannabis, you can take this very, very small amounts to really control the effects. Again, everything is laboratory tested for concentration and contaminants as well. So everything is dosed out and also depends on the amount. Anything that could be added, like any type of bleach or mold or anything, everything is tested to make sure that's clear before anything is sold in the dispensary. And it's safe but effective. There's never been a recorded case of an overdose or fatality of cannabis, and especially anything that is regulated, anything, that you purchase somewhere else. That's when you start running into a very gray area and an issue. Like, for example, if you buy like a CBD oil that's not regulated, it might say laboratory tested, but they might not be approved through the Department of Health. Any lab in Pennsylvania that our dispensary uses is a Department of Health approved and regulated. So it's just very important to do your research and make sure anything you're purchasing is safe. So how to become a patient? The first step is to go on the Department of Health site and register to be a patient through the medicalmarijuana.pa.gov. And then to obtain a physician certification that you suffer from one of the 23 approved conditions. There's a list of the, there is a list of the physicians on the site that you can use, or if you're just interested in getting a referral to someone, you can always call us here at the dispensary and we can get you in contact with someone that can often do telehealth as well, which is really nice because you don't have to leave your house or, have to go to their office or anything if it's not local. And then once you get your card in the mail, it looks very similar to a license. Once you get that in the mail, you can visit a dispensary after your first appointment, which again, unless things change, but right now everything is telemedicine. But once you, soon you might be able to speak to a pharmacist one-on-one, depending on the way things progress as COVID restrictions change. You can also be a caregiver for patients. So you can have a caregiver can provide care up to 5 patients at a time. So if I wanted to, have 5 different patients underneath me, I would come to the dispensary to pick their product up for them and then give it to them. It does take a little bit longer to become a caregiver because you do have to go through fingerprint and background check. And once you go through that, then you would get a caregiver card and be linked to that patient. And that just gives like one line just to make sure it matches your driver's license, and it has to be exactly as it appears because it can run into some errors then. And here's a picture of the list of the Department of Health approved practitioners. The list is very, very long now, but we do definitely have some local. We have about 20 doctors locally. If you're interested to speak to them to become a patient, a medical marijuana patient. So Organic Remedies provides the opportunity to speak with an expert pharmacist. And again, can be teleconference. The pharmacist and physician consultations are always free of charge, which is really nice. You can have their guidance anytime you would like, or anytime you're like, this isn't working as well as I thought it would. It's definitely very important to talk to them or talk to one of our patient care specialists here, because we can help get you something that's going to help better. Appointments can be made at your convenience. We're open Monday through Friday, 9 to 7, Saturdays, 9 to 5, and Sundays, 12 to 5. So 7 days a week. And then we would love, to help you figure out, any product form, dosage, and strain forms as well. So we talked about the overview of the PA medical program, also qualifying conditions, the science behind the stigma, available products, the registration process, and the certified physicians. And I'd love to give some time for some questions. I know virtually it can be really tough to feel like, we can talk like normal and like face to face, but I know that was a lot of information. But if anything comes to mind later on, or if, you're like, actually, I have a couple questions about this, you're welcome to reach out to my email. Organic Remedies in general, with it being local and in this area, just Chambersburg alone has about 40 employees. Also, we get confused often, the grow right down on Wayne Avenue as well, that's us. That's not us, that's Grassroots, but we do carry their product here at the dispensary. Cannabis in general has created incredible jobs for the Pennsylvania area. And we also have our own grower operation in Carlisle that has about 80 to probably about 100 now employees as well, and in the grower operation as well. So, it is growing tremendously, creating a lot of really good jobs and careers for those. And we'd love to get involved with the community, especially myself, but to be involved with next week, we are having, I think it's the 19th, we're sponsoring the Franklin County cyclist race. So we love to be involved with really, any community events going on and sponsoring them, or any way we can get our team involved with volunteering, or, any trash pickup or anything like that. If you guys have anything going on, we are more than happy to get involved with, anything in the community and help any way we can to help make a difference. So if anyone has any questions or concerns with that, or if anything comes up that you could just use an extra hand, please feel free to contact me and ask for me. And I'm so happy to get involved. Yeah, thank you everyone for joining virtually. And like I said, any questions, please feel free to ask. I'm kind of bad with computers. If someone did type something out, I might not see it, but I will try and.
Good. So we have a couple questions in the chat so far, and if anybody wants to unmute and jump in, you're free to. I think you have that capability. You'd think I would know my way around Zoom by now. So the first question we have, Mary, is can you explain how this affects workplace drug tests?
Yes, that's a great question. So in Act 16, it's actually section 2103. I swear I'm not a snobby know-it-all. I get that question a lot, so I've memorized that part of the section in the law. But so basically, legally, you cannot be discriminated for being a medical marijuana patient. It is very important to know your patient rights. So I always say before you become a patient, or someone is going to become a patient, definitely read Act 16 and know, your rights as a patient. But in that act, it says legally you cannot be discriminated for being a medical marijuana patient. That means, obviously, if you're showing up to work under the influence or anything like that, that runs into an issue. But if it's just, if they do a screen drug test, or that's something that would definitely be of issue, because marijuana can stay in your system for up to 30 days. legally, you cannot be discriminated for having your medical card. Again, so we see patients all the time, lawyers, teachers, and everything in between. And, if they're using at night or using something that doesn't last or help or inhibit what they're doing during the day, is a great question to ask. But there is I have definitely ran into that and have seen issues with patients that if they have been terminated, have gotten a lawyer and won the case. So legally, they cannot discriminate for having the medical marijuana card, as long as you're not working in a federal job as well. That's something to keep in mind, because federally, this is still a Schedule I drug and is considered illegal.
That is very interesting. I didn't know that.
Yeah.
The next question, Terry said, how does this interface with CDL testing for truck drivers?
It can be really tough. Each company is different. I have seen CDL drivers. It just depends on having that talk with your HR department. Legally, like I said, with Act 16, they cannot discriminate for having the medical marijuana card. But with CDLs, I know it's a little different. With having your card, and then if you test hot, that would cause an issue. So it would just be having the talk with HR. Every company is different, especially if it's yourself. Like if you're employed through yourself, I know through CDL, like some are that as well, like truck drivers and things. So legally, you can't be discriminated for having your card. There's still a little bit of a gray area, especially with, firearm purchasing, CDL, things like that. It can be tough and a bit of a gray area.
Gotcha. Does insurance cover the costs?
Unfortunately, no. Everything right now, at least in Pennsylvania in our dispensary, is cash only. Roughly, a patient is spending around $130 a month. This can definitely change, depending on the amount they're using in the forms. If that's something that they can't obtain, we can definitely look at ways of using, lower costs for sure. But unfortunately, no, insurance does not cover any of the costs, just because of the federal issues that we run into. Everything is just cash. We don't even accept cards at this time.
Insurance is so tricky.
It is.
Yes, the recording will be available. I will email it to all of you. Oh, and then Terry responded back. So using your products will produce a positive drug test.
Yes. Anything that has THC in it, even 1%, can stay in the bloodstream or show in a drug test for up to 30 days. So that can be pretty tough. But like I said, there's definitely, I'm not saying that there's ways around it, but we see roughly about 450 to 600 patients a day in the Chambersburg dispensary. These are patients that range anything, like I said, from, lawyers, teachers, doctors to, construction workers. We definitely see everyone and everyone in between. So with that volume of patients, I know that it's regulated, but it might not be enforced, if that makes sense. There's definitely a bit of a gray area with it, even with the firearms, with CDLs and things like that. We see it quite often, but I know that with the medical marijuana being so prevalent, over 500,000, there's over 500,000 patients just in PA. So there's definitely some, CDL carriers and, within them.
Okay, Nancy asked, if the employer has mandatory random drug screens, how do you handle this if the employee has a medical card?
Yeah, technically, if they, it would definitely be just having a talk with the HR department. I even have printed out here at the dispensary that Act 16, Section 2103. If you write that down and look that up, you cannot be discriminated for having your medical card. Meaning, if they have no reason to, prove that you are under the influence at your workplace, or that's not inhibiting any of your, job or anything you have to do during the day that affects your performance. Legally, they cannot discriminate you for having your card, meaning they couldn't discriminate you for testing positive. If you have your medical card, it kind of keeps you protected. It can be tricky, but we see it quite often. And there's definitely like lawyers that are involved with just the medical marijuana program, but Act 16, that it is legally, that is kind of your right to have that medical marijuana card, and gives you the right to, that would give you a positive test. If they have any reason to think that you are under the influence or anything, that kind of throws that a little bit different. But if it's just a random drug screening that you're randomly chosen for, and they show that they randomly chose you for that, and you just happen to be the one, and you have disclosed with your HR department that you have your medical card, then yep, you have the right to have that.
What about from the perspective of an employer?
Yeah, so it's very important for HR to know, that those are your rights to have your card, and also to learn Act 16 as well. So if someone, isn't showing that they are under the influence, then legally they cannot discriminate an employer for having a medical card.
Terry said, what about safety sensitive workers? I think that may have been back in reference to the positive drug test comment.
Yeah, and a lot of these, if there's something that, an accident happens or something that can run into an issue, of having your card, that's where you kind of run into that gray area. But I can tell you, with, seeing patients every day, one-on-one, a lot of these products, when medicinally used, give you very, very minimal head effect, especially if you're using them medicinally dosed as well. Of course, you can't control everyone. This can be just like with anything, even with, prescriptions that you pick up from CVS. So you kind of run into, the trust as the person and the patient, just as being a patient with, picking up pharmaceutical prescriptions as well. So it's kind of using them at your own, your body best. It's going to keep you clear-headed and focused. And what's going to last that long too. I could use a product in the morning if I'm in pain or something, and I know if I have, for example, I have to be at work at 9 a.m. I will make sure that something won't last that long, like vaporization methods or even tinctures, depending when you use them, won't inhibit your functions as the day goes on, because they won't last that long. And just talking about me personally, I usually only have to use it in the evening if I am in pain or if I have had trouble sleeping. But by the time I wake up, I don't feel it at all.
Okay. Does anyone else have any other questions to add here? I know it seems like you had a lot thrown at you, Mary, but you're very, very knowledgeable.
Oh, okay. Yeah, I know it's tough with it being federally illegal and with the jobs, and with that, there is a bit of a gray area in the law itself. But no, if you have your card, and if a patient has their card, you do have the right to have that card, and you are protected because of Act 16. Of course, individual situations can be a little difficult, but with that, I mean, we see so many patients every day, and with it being a gray area, and if you communicate with your employer, I know each relationship is a little different, but it's just like, it's really no different. It's just an alternative method to, something that you would pick up from, CVS, a pharmaceutical that could give you head effects or could give you, if you use too much of it. So it's just important to know that what you're dosing and what you're using, just to communicate, with the pharmacist or with one of us, that, you need to stay clear-headed and focused. And it can be tough because, the drugs over at CVS won't give you a positive drug test if, they're testing for their blood for, THC levels. So it can be tough, but with Act 16 and your patient card, you are legally protected.
That's so much information that I had no idea. I'm very impressed. I'm also impressed that you memorized the number. I totally understand though. The stuff you have to say so many times just gets hammered into your brain. Okay. I think unless anyone else has anything to jump in with, are we good? You good, Mary?
Yeah.
Anything
yeah.
else to add? That
Love
was
to have something in person. As soon as things open up, it'll be so nice to be able to talk to everyone and get to see each other face to face and eat some lunch and relax.
yes, we will definitely try and get something on the calendar before the end of the year. Hopefully we're getting closer to normalcy again.
Yeah.
Someone said this is great information. Thank you. I agree. Thank you so much for your time, for all of your knowledge that you're willing to share with us.
Oh, no problem. Thank you.
Yeah, I hope that we can do this in person.
Yeah, I would love that.
Perfect. I will send everyone the recording for those of you who jumped on late so you can catch up with the beginning. And I think that's all we have.
All right, everyone. Thank you so much. I appreciate
Thanks.
you.
We appreciate you. Have a great day.
Thank you. Bye.